on our kids. So what we see is there's probably really a problem with the gut, isn't there? Anybody ever have gut pain? I know I did while I was getting chemo. My husband said I went crazy. So I didn't behave with stims, but I sure did behave, and it was miserable for everybody because I hurt, okay? So if we take our gut and let's look at that gut disease. Are you sure there's a gut problem? Well, yeah. If I talk to the mommies and the daddies, I find out that the kid had difficulty breastfeeding, that they've got colic or had colic, that they had reflux. They might still have reflux. It didn't necessarily go away. The eczema, the food sensitivities, and then self-injurious behaviors, poor sleep. Did anybody have reflux while they were pregnant or now, and it wakes them up from sleep at night when you got a big burp after bed? So if you can't tell anybody that it hurts, might you not just get up for the day because you don't want to lay back down because it's just going to irp right up again? Okay. So why should I give that a sleeping pill? How about if I take care of the reflux? What do you think? Okay. All right. So this is a pretty picture of the lining of the gut and how close and how well the lining of the gut interacts with our immune system. Okay. This is all from one child pooping one day. On the left is what a normal x-ray should look like. On the right is what constipation with a few farts looks like. No, really, that's the dark spots, okay? You can just take that home. That's what that is. When it gets all the way down there, it'll make a smell and a noise. Okay, so this is a picture of what you can do when you change diet, all right? So this happened over the period of about 9 months, from messy, disgusting diarrhea in a diaper to something that's a pretty decent looking stool, a whole lot better looking, in a toilet. Anybody like that to happen in their house? Yeah, all right. Reflux. Here's some evidence on, and I think some of these pictures are in your handouts, I tried to put them in there, that there is in fact a problem with reflux and what it looks like. These are very, very real. These are all from Art Kriegsman. The colon on the left is normal. The colon on the right belongs to my daughter. Okay? You think she hurt and she couldn't tell me? Yeah, okay. This is bile, which you all know is supposed to be down in the small intestine, past the liver kind of thing, right? Except that it says the esophagus. Well, gee, that's not a good thing, is it? Okay, you suppose that kid didn't feel very well? These are being documented. This is all very, very real. These are small bowel ulcers. You know those mouth ulcers that you get inside, the aphthous ulcers that hurt like stink and you would like to do anything in the world to make them better? What if you had one in your small bowel? Okay. What if you had great big ones that were losing protein and you couldn't thrive or gain weight? This is posturing. It's behavioral, isn't it? No. This is my belly hurts, I can't poop, and I need to do something to make it feel better. My belly hurts. My belly hurts. My belly hurts. My belly hurt so much I hit my head all day and ended up in the hospital. Okay? So, is there evidence of it? Yes. We do organic acid testing to look for the dysbiosis, the bad bacteria that shouldn't be in the gut that are causing problems instead of good bacteria, okay? We do all kinds of stool testing, and we find yeast, and we find Pseudomonas, we find other things that just really shouldn't be in the bowel, and we need to get those fixed, all right? Now, is autism a brain disorder, or is it a disorder that affects the brain? Okay, I think one day we're going to end up saying it's both. But the important thing to remember, and Martha Herbert said this a long time ago, the brain is wet and it is attached to the body. What you do to the body will impact the brain. And as Jenny McCarthy said on television so well, anybody who doesn't believe that, let's go down to the bar and test that theory, whether or not there's a gut.